All right, we're still covering material from Chapter 11 where we're talking about screening tests and the value of screening tests to identify individuals that may be at risk for developing an infectious disease or a chronic disease or a health behavior outcome. Screening tests are also used to identify specific risk factors, or those that may be more prone to developing a particular disease because they have these particular risk factors with maybe the way they eat or the way they participate in specific risk behaviors. And I left off talking about the differences between a mass screening technique and a selective screening technique. Selective screening could be done or can be completed within an occupational workplace scenario where you're trying to subset or screen a subset of the population that may be at risk for developing a chronic disease based on specific exposures, whereas a mass screening technique would be at a large scale or a total population scenario to look at the health risk status of that population. I want to spend a couple of minutes talking a little bit more about mass health examinations, and this is based on population or epidemiologic surveys. And the purpose behind them is to gain knowledge regarding the distribution and determinants of disease in a selected population. If you remember, we use those terms at the beginning of the semester in the definition of epidemiology, the distribution and determinants of disease. And so we have screening tests that are used within mass campaigns in order to try and determine what is the underlying rate of disease within a population that may be at risk. There's oftentimes no benefit to the participant when you do these types of screening surveys. For example, you could look at seatbelt usage or car seat usage surveys where people go in and they could receive education, but oftentimes there's other data that's collected and there's no immediate benefit to them participating, as in that particular data won't go back to them to help provide additional change or control. But it helps as a public health entity to know where to direct specific types of prevention as well as treatment. And that for example, one can look at the CDC, at the weekly morbidity and mortality weekly report, and see that they do these types of mass screenings or these mass type of data collection scenarios with screening tests to determine rates of disease specific to like notifiable disease by state, by region, and they do it on a weekly basis, constantly gathering that information to determine what is the potential risk that we have within our state. And you can see that all the way at the bottom of the slide for specific types of diseases with meningococcal disease, mumps, and pertussis from a couple of years ago. With mass health examinations, there's a lot of surveillance that can be completed using surveillance tools or screening tools, and it aims at the protection of a community health through case detection and intervention. That's the ultimate goal with surveillance using screening tools, is that you're trying to determine what is the basic health of a population and can we identify new cases and is there intervention that could be implemented. As well as the goal of these types of mass health examinations is to actually identify maybe new cases or through opportunistic screening. The utilization of screening tests for detection of conditions unrelated to a patient's chief complaint. So in mass health screenings, you're collecting data, but oftentimes on a specific disease. You're collecting data on a certain disease of interest, but in addition to that, other types of screening tests can be offered in order to potentially identify ones that may be at risk for other types of disease that they're not actually coming in for. And this is where screening tests can be offered to patients specific to a certain age. They go into a physician's office maybe for a cold or for another ailment, but then they're offered these screening tests to potentially look at risk. For example, we know that certain age populations are recommended to receive colonoscopies or prostate exams. And for example, for me, when I went in a number of weeks ago for the diagnosis and treatment of the blood clots in my right leg, since they were already drawing blood, the recommendation that from the physician was to run a PSA, or a prostate exam blood test, to determine whether or not I had an elevated indicator for risk of prostate cancer. So it really comes down to, though, when we talk about screening tests, is that we need to understand that there are appropriate situations for screening tests and programs and when they are to be implemented. Screening tests are not just to just gather information, and there is a time and appropriate scenario when they should be implemented. And some of that you need to look at as in how valuable is that screening test to an individual or to the overall public if we're looking at a community scenario. So even though I talk about mass screening examinations, there has to be a benefit at the individual level and or at the public or the community level. And that's where we take into consideration the social, scientific, and ethical considerations. For example, within the social consideration, the health problems should be important for the individual and the community, as in what is the magnitude or the number of cases that we're actually talking about. If we're actually going to have a screening test or to recommend a screening test be used, is it really a major health issue? And is it appropriate to screen individuals within this community with this particular test? For example, would we screen students, faculty at USU for malaria? Malaria being an infectious disease transmitted by mosquitoes. We don't have the mosquitoes, and we actually don't have malaria present. We do know that individuals in Utah are infected with malaria, but it's a result of traveling to countries and areas where that exists. So from a social standpoint, the health problem is not important to the community for malaria at this particular time. Another aspect that needs to be considered is that diagnostic follow-up and intervention should be available to all who require them. That's a social consideration when we talk about screening tests, is that if you do a screening test and there is a treatment or an intervention that is available, it should be available to all that participate. And there needs to be also a favorable cost-benefit ratio, as in, will the public actually participate in the testing because they see that the use of this screening test and the information that can come from them, from the data that comes from the outcome of that test, there's a real benefit to that. And then public acceptance must be high for a screening test to actually be implemented. And several years ago, when I started teaching this, genetic testing, the idea that you can go and receive genetic testing, it was thought as real taboo, as in it's private, and why would one want to go about and take a sample of DNA and run a magnitude of tests across looking for different potential genetic diseases as well as potential chronic diseases in their future. It's interesting, though, is that if more information becomes available, public acceptance of genetic testing has become much more acceptable. Not quite there yet, but because the idea of trying to implement genetic testing in the workplace, as in you need to have your DNA analyzed before going and working in a particular place, is not accepted at all. And then another aspect that needs to take into consideration is the scientific side of things, where early detection efforts are most likely successful when we actually understand the natural history of disease. It's important for us to be able to understand the spectrum of disease. So with respects to a screening test, you need to be able to use a screening test early enough in the phase of the process of the disease to where that you can implement a particular change or prevention to alter that outcome. And so some diseases, we don't understand that natural history all that well until they present with symptoms. But from a scientific standpoint, a screening test is only effective if we really understand that natural history. This knowledge permits identification at those early stages. and we're able to understand the appropriate biological markers with respect to progression. Another aspect of it also is that we need to, from a scientific standpoint, is that prevalence of the disease or the condition is high, as in there's lots of individuals within the community that would test positive with that screening test. For example, we know that high cholesterol and high blood pressure are effective indicators for heart disease. And with having lots of individuals that have high blood pressure or high cholesterol, a lot of data has been collected to determine that that is a good indicator for heart disease, and it provides a reliable screening test. And then there's the ethical considerations that need to be taken into account. Is that it is ideal if the screening program is implemented so that it can actually alter the natural history or condition. It's not so much all that valuable or even ethical to have a screening test where you can diagnose an individual early, but there's no treatment or there's no change that can be made. So just having that information, is that really ethical? Suitable, accessible tests for screening and diagnosis of the condition, as well as acceptable, effective methods of prevention are available, and that's really important. So I give you some things to think about. Is what about screening individuals in late stage HIV that have already begun to progress to AIDS? Having a screening test early in the viral replication process phase or stage allows for change of prognosis, but at late stage it may be not ethical to implement or to have a screening test such as that. Or another thing to think about is that, do we screen individuals that lack insurance or physician care? We would say that's heartless, but at the same time, if they are unable to receive treatment, what do we do in those types of scenarios? And do we want to have a screening test such as that? And then we move on to talk about what makes a good screening test and what kind of characteristics would we want to see within a screening test. It needs to be simple, as in it should not be implemented or it should not be where a physician has to be the one that will complete the test on the individual. For example, you want to have a screening test if you're looking at behavioral disorders where it is not necessary to have a psychologist or a psychiatrist. Can there be a survey that can be implemented? Or a rapid test for an infectious disease? Do we have to have a physician? And the reason why is that if we're trying to look at ways to reduce costs and to do it quickly, it is much more effective if it is simple as well as rapid, where we can quickly administer the test, but also be able to obtain the results rapidly and accurately. As I said a second ago, a good screening test needs to be inexpensive, where there is a good cost-benefit ratio, as in health departments have to be able to afford these particular screening tests. Or can a screening test be implemented in an underdeveloped region, and can they afford that? So if you have a very expensive screening test, people won't be able to use them. Is it safe, where there is no harm to the participant, where they're able to participate in the screening test, but there's no long-term disability or outcome as a result? And then last but not least is that it needs to be acceptable to the target group, the ones that are actually participating in the screening test. Are they willing to do and accept to complete the test? For example, we know that mammograms are widely accepted as a screening tool for breast cancer. But when we look at, for example, testicular cancer, there is good screening tests that are available, but it has not been widely accepted by the target population. And so that's where a good screening test, in order for it to be implemented and to be used, it needs to be simple, rapid, inexpensive, safe, and acceptable.